Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Coach Show. So today we have another special guest as we continue in our series, Careers in Dentistry. Careers in Dentistry. If you like this series, be sure to subscribe to my channel, Dr. Darwin Speaks on YouTube, as I will be posting new episodes every Monday and Thursday, and I may throw one or two in the rest of the week too, maybe one or two depending. But also, if you have questions or comments or topics that you want to hear more about, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. So today, we're going to learn about prosthodontist and prosthodontics. We have a good friend of mine, classmate, double classmate. I've known him. Oh man, it's been about 31 years now, right, Doc?
It's incredibly how much time it's actually been.
Yeah, man. So we're joined today with Dr. Ben Watkins, who is a board-certified prosthodontist and just an extraordinary dentist in person. So, Doc, hey, thanks so much for joining me today and joining us on the show.
Hey, thanks for having me. It's been a pleasure of mine to be when you invited me to be able to be on the show. I was excited because, as you just said, we've known each other a long time. So this is just a new environment for us to express our friendship over a passion that we call dentistry.
That's right, man. That's right. So, hey, if you would, tell us a little bit more about yourself.
I'm a guy who's originally from Washington, D.C. I'm a son of a dentist. So I guess it runs in my blood. And I know you have dentistry in your family, so we've talked about that as well. And being born and raised in Washington, D.C., I have a lot of pride for living within the district as the city is evolving and emerging in the last probably decade or so. And so in terms of my sort of upbringing, I am, like I said, originally from Washington, D.C., but my dental school training was along with you at University of Maryland. And even before that, it was the University of Virginia, which we have hold tremendous pride for.
That's right.
And so that's been kind of my evolution.
Sounds good. So tell us a little bit about your position and what you do as a prosthodontist currently right now.
I'm a private practice full time. And what does that mean for me? I am in the office Monday through Friday. What do? I treat patients who want to see or need to seek an individual who's a restorative specialist. That means crowns, bridges, dental implants, and complicated situations where a patient's bite might be affected or ravaged because of various reasons of trauma or just wear and tear over the years. So largely what I do is being able to reconstruct someone's oral sort of a bite, as well as also their aesthetic smile. And often when they are very broken down and need either treatment of some teeth or all of their teeth, I'm the one that you need to see.
Gotcha. So for training like this, for this, this is a specialty. This is one of the several specialties that are recognized in dentistry. Tell us a little bit about your training, what someone could expect as far as dental school, after dental school, fellowships, internships.
So good question. I was one in terms everybody has their different evolution through. There are those who may do a GPR or an AGD prior to their residency, but now the requirements for a prosthodontic residency are 3 years after dental school, and you can do more in other areas. I mean, my particular evolution was that I was one of the very fortunate ones that I was the last of the 2-year group that before they made it the 3-year requirement. However, I still didn't stop there because after I did my training, my residency down at the Medical College of Virginia, now known as the VCU or Virginia Commonwealth Dental School, that I was the last of the 2, and so anyone coming in after me was 3. And so after that, I moved on to the University of Maryland for a advanced implant prosthodontic fellowship, which was another year of training under the direct tutelage of our prosthodontic department mentors. And they were the ones that, sort of guided me through the surgical aspect of the training of dental implant, whereas prior to, it was strictly the planning, the restoring, and the and just the guidance as the quarterback of a large restorative case that might require different areas of specialty: endodontics, orthodontics, oral surgery, and so on. And finally, when you come with the restorative dentistry, to be able to make it all kind of come together and make the patient sort of feel and look good.
Gotcha. Now you mentioned implants, which is a very, very hot topic. A lot of, especially for new dentists getting out of dental school, and also just for practicing dentists. A lot of us that have been practicing for years, we're seeing that how implants has kind of revolutionized dentistry and being able to restore someone's bite. And it's and there's a lot of training that's out there. I think there's a misconception though that a person can go to a weekend course, maybe on a Friday, Saturday, and Sunday, and that Monday I can basically just start placing implants, and it's not necessarily the case. But your training is such that it allows you to have a better perspective as it relates to implants, because now there are a lot of general dentists that are placing implants. How do you feel like your training as a prosthodontist enhances that learning, or how is it different from some of the actual weekend courses that are very popular right now?
I think you're bringing up a great point about those types of weekend courses that empower a dentist on the way in which they are going to approach a certain problem with a certain technique. And I say certain technique, or maybe a couple of techniques. Well, as you know, in this profession, that there's always going to be multiple ways for you to be able to to move a patient from a challenging situation to a successful, healthy dentition. And I think the weekend courses may be able to do a great job of being able to show you the process. But I think quickly, and anytime I've been to any sort of any kind of continuing education courses, that I've always marveled at the knowledge base in which the presenter has, and being able to talk about a particular subject. And when I talk about the base, that means understanding all of the sort of historical techniques, ways in which they didn't work, to be able to progress it through and actually apply that in a clinical situation under the direct tutelage of your mentors and colleagues. There's no substitution for that day in, day out, sort of all day long sort of touch with that instructor versus, say, a weekend course. It certainly expands your knowledge base, but to expect to be able to do and plan and execute accurately, much like a specialist does, I think it's very ambitious to be able to expect that program, that shorter program, is going to yield an expert's level of ability to do the exact same thing. So I think it's excellent that they're available. Yes, we should all proceed with being able to expand our continuing education knowledge in a said area, but we should be careful with thinking that what you've learned in a 72-hour period can be applied at a specialist level come Monday morning. Right. And I think that you have to be very judicious on how you're going to be able to use that next bit of technique, store it away for future reference, as opposed to sort of expect that you can do this at a specialist level, a few hours later.
Right. Sounds good. So talking about the hours and the weekends and the training, give us an idea of what your typical day is like as a prosthodontist.
That's interesting. Because, I had a young high school student today who was shadowing me, which part of her sort of senior graduation experience, they have had an opportunity to choose an area of expertise that they wanted to get further knowledge in, to just expand their horizons. And so dentistry, and this young individual, was a passion of hers ever since her time with her orthodontist, and she decided that she wanted to spend 2 weeks with my office, just sort of observing and hanging out. Typical day, that was really atypical, but boy, is that a fun time when I have a student, a fresh mind, a sponge, sort of just hanging out, learning like what I do on a basic everyday base, everyday day in and out sort of schedule. So her first day that she was in my office here, my first patient was a dental implant patient where I had to do a crown lengthening and a placement of an implant, and then place their provisional and let her see what that was actually about. So I was explaining to her, I was like, listen, I have to think that as most dentists probably actually haven't seen an actual implant being placed and seeing how that actually works. They may have seen it on YouTube. They may have seen it remotely, but to actually see it up front, she got like sort of firsthand experience on that. So that was fun to be able to have that. And then it just sort of melds into, gee, I have to do like a basic couple of fillings on a patient. I may have to do some concurrently while all this was going on, have either 1 to 2 hygienists sort of seeing patients on an hourly basis that required me to then go check them. And those might yield areas where I need to educate a patient. I might need to treat a patient further or schedule them for more treatment. So it can really kind of revolve around something as complicated as an implant placement to something as a simple filling and a hygiene check.
Okay, so it sounds like your office, the way your practice is set up, sounds like you do more than just those complicated cases. You do those, but it sounds like you have some bread and butter or regular restorative patients, and you've got a hygienist in your office.
Sure. I think it's great to have both sort of areas of either patients being referred to me by specialists that come to me for specific procedures. And then there are those who just want sort of at the other end of the spectrum where it's just simply routine care. They just want to be under the care of a dentist who can take care of their basic needs. So those are fun. You'll be able to have both ends of the spectrum because I get a chance to educate those who I can prevent them from getting into those very complicated situations. And as well as also I get gratification with being able to guide an individual through a challenge of theirs so that when they look in the mirror, they have tremendous pride and it can change their life just by simply doing something to their teeth.
As a specialist and as a prosthodontist, you mentioned something about referrals. What percentage would you say of your patient population is actually from being referred to you from, whether it be other dentists, GPs, or other specialists? What percentage of your practice?
I think what you're talking to is, when you have hygiene in your office and there are patients that are just sort of on a regular sort of hygiene schedule, whether it be 3, 4, or every 6 months, if you're going to maintain those individually, you're just going to have in-house or sort of internal referrals from that. And then you're going to have, in my world here, I have other specialists or other general dentists that might refer cases to me on issues that they don't do or just sort of feel like it's kind of gotten a little out over their head or just not in their comfort zone. Right. So I think I'm a full believer in making sure that you are a specialist in whether you're a general dentist in your area of expertise. And I can tell you that those challenging days are when I've gotten outside of my comfort zone and have done things that I think that are just a little further than what I feel most comfortable with. And those are the times when you understand the why other specialists exist, so that you can refer that individual to someone who really can manage it, seamlessly.
Right.
So a lot of those individuals come to me because that's exactly what a general dentist or another specialist has encountered or perceived in the patient. It's just something that they don't either want to do or they don't excel at doing. And so they will refer them to me, whether it be a full mouth rehabilitation, TMJ, jaw issue, or simply just they need a great dentist.
Gotcha. So you mentioned what your typical workday is. In that workday, what would you say is your typical, like, your work hours? And I don't know if you work in the evenings, you work on weekends.
Yeah, I'm fairly set, having office team members. We don't call them staff any longer here. They all want to be known as a team member, which I'm a full proponent of. We all work together in a very small environment. It is a team effort. We are sort of all in the same rowing boat here, going in the same direction. So, my office hours are very set because everybody else sort of needs a set schedule as well. So we have a set of hours from about 7:30 until about 4:30 on Monday through Thursday. And Friday we close about a half hour to an hour earlier on a Friday, just to give everybody a little break after a long week.
Gotcha. So you mentioned some procedures that you typically do as a prosthodontist. You mentioned implants. some dentures, some other types of restorative care. You have a hygienist in your office. What are some of the unusual or not so usual cases that you will see specifically as a prosthodontist? And I know there's different types.
Yeah, I'd say that I think the unusual ones are ones in which the individuals have been treated multiple times and they've had a less than successful outcome. And they're looking for someone to fix what has not gone well. And those are some of the atypical, some of the most challenging, because not only are they more challenging as a restorative case, just technically, but then there's a whole emotional component that comes along with an individual who's gone through that process that you also have to also manage psychologically. They typically, what I mean by that is that there usually is, by that period of time, some level of frustration, some level of despair, some level of hopelessness, and that the bar is usually pretty low in terms of what they think their level of success could be. And that's where I would say I come into giving them greater hope. And that's where I honestly say at the end, when they have that kind of successful end product that they weren't thinking was even possible, is a very, very positive and rewarding day for me. And that's the reason why we do it. We want to change smiles and change people's lives.
That's right. That's right. As a prosthodontist, what's an average or a range salary-wise as far as your income?
It's something you ask that because as I have another partner and we have two offices, and sort of the practice has been typically a group practice. And so we are at that period of time where we're looking for an associate. So as an entry associate there, I think the numbers will vary. I think as a owner, they're going to be higher. That numbers or that salary range, I think for an entry level prosthodontist coming out of their residency and working as an associate can be a flat, usually salary is what we offer. There are different ways to be able to do it where they might work strictly off production. But what I think is most fair and for you to be able to sort of get started is that if you're going to join an office as an associate, getting a salary of somewhere in the north of 120,000 is probably reasonable, with the opportunity that if you have a certain mark that you can do better if your patient load does increase, and that you're are very good at being able to build your practice.
Okay, and I guess it gets a little bit more for you as a prosthodontist owner, especially if you have one or two or multiple.
Sure, it's sort of hard to kind of put people into sort of like one range because it's to superimpose a situation over another person's. I think you have to maybe boil it down to simply if you have one office, one location, you can probably expect a certain amount here. But I think it's often not about once you become an owner. There are a lot of other variables that you have to consider that are really, honestly, it's overhead. And I'd say that's an important component to look at as a prosthodontist. It becomes more expensive to do what we do, to deliver the same product or deliver a high-end product and result. And so that I will tell you my overhead in the office runs around 70%, which, if you look at another specialty, such as endodontics, the average sort of overhead is going to be probably more like in the 50 to 60% range, which at the end of the day, as an owner, what that means, it's a matter of what you keep. It's not about what you make.
Right. So that 70%, is it usually typically a little bit higher because of the more of the lab costs that you all have as a prosthodontist? What else is into that higher level of overhead?
Well, I think time is a big function of anything, and time is money. So if it takes more time to be able to produce a complicated end result where it means multiple appointments, more time outside of the actual treatment of the patient, being able to think through various steps and to navigate that it does take time to be able to take care of those patients in a meaningful way. So the costs come in the function of time, and yes, the lab bills are more expensive because just usually the type of product that you're producing is more complicated.
Right, but thank goodness as a specialist, your fees are higher also in comparison.
Yeah, you have to compensate for that because everybody has to understand what you're getting. So yeah, the fees are higher to be able to cover the cost of the expense of treatment.
Sounds good. So winding down now, you've been practicing dentistry. Oh man, long time.
More years than I care to quantify.
That's right. That's right. But it's over 20 years.
It is.
You've been an owner for a little bit less than that period of time.
Yeah.
Knowing what you know now as an owner, as a prosthodontist, as a practicing dentist, knowing what you know now, what would you do differently, if anything?
You know, this is such a plug for your show, because honestly, I would go straight to and find the fastest and best mentor I could possibly find. That's someone who is more years than I would have under my belt, that I would seek as an advisor, as someone I could bounce off my ideas, provide guidance for me in areas where I don't realize I need guidance. So aligning yourself with a trusted individual who has experience and has their best interest in mind is who I would seek immediately.
Wow. You said immediately. Yeah, that's good.
I mean, think of having a coach, you know, even now as a person who's been out 20 years and plus, I actually have a practice coach. So that's a person that makes me accountable for the things I need to be doing. And sometimes I don't necessarily always know exactly what I need to be doing, but this is an individual who's more senior to me and has had years of experience and has had ability to advance his knowledge outside of the actual clinical dentistry, and has gone to corporate America to sort of outside of his own comfort zone and a passion for how business actually runs. And so he's brought that knowledge back to dentists so that we have an understanding on how to be able to run our businesses better. As you know, as well as I do, that's not something they taught us in dental school. It's not something they taught us in residency. That is trial by fire. And I think that I would spin my wheels less if I had probably aligned myself with an individual like that earlier in my career.
Gotcha. Okay, that's a good one. That's a good one, which leads me to the next question about advice. What advice do you have for those aspiring dentists, those that are thinking about pros as a specialty, or just in general? What advice do you have?
I think, again, it's further aligning you with another mentor. I mean, you can have more than one mentor. In fact, I encourage it to have more than one. But ultimately, I think you really just need to see if you're planning on whatever it is you're planning on doing. If it's going to be academic life, it's going to be private practice, you need to be hands-on in that arena. You need to be visiting, ideally invite yourself and ask for an invitation into another prosthodontist office that you might admire. And I can guarantee you that they would be open-minded to be able to mentor someone who is eager and interested in their profession.
That's great, man. That's great. So, hey, we're going to wrap up now. So, 4 questions. These are 4 questions we ask everybody on the show. First question is what's your favorite day of the week?
I think favorite day of the week is, hey, come on, man, it's got to be Friday, man. I mean, after a long week, Friday is where it is, man. So, we all live for the weekends. I have a set of twins who are 12 years old, so spending time more with them and my family and my wife, the weekend is where it is. So I had to think of Friday as when, sort of the big sigh of relief comes.
That's right. That's right. All right. So second question. What's your favorite food?
Gosh, I think I have to narrow that down here to 2. Sorry if I can't have a favorite here. I have to say, listen, I can name you the restaurant, I can name you the dish, and that's Nobu for that tuna sashimi with jalapeno. And I could sit there and eat that all day. Shovel that right in. And secondly, you could probably twist my arm to go get a New York strip at Morton Steakhouse anytime. So you're buying next time.
There you go. Surf and turf. I love it.
There you go.
I love it. So third question, what's your favorite procedure or task that you do in the office?
I just did it today. It was a veneer. Anterior veneers are just a wonder. To be able to truly, in a very short period of time, change how somebody feels about themselves and have an impactful experience, and let them know that you were the one who helped them get to that place, that helped them change their opinion of themselves, is really my most fun procedure to do.
Gotcha. And last of the 4 questions is, what is your favorite thing to do outside of work?
I'm a sports fanatic, but honestly, people wouldn't believe it, but I grew up playing tennis, and tennis has been something that I played since I was about 8 years old, and I have tried to pass it on to my my twins, which they love doing it. They love tennis and soccer. But tennis is really, if I had to pick a time or pick something I wanted to just really do on my own time, I would find a court and some friends and get out there and have some competitive tennis matches going on.
I got you, man. That's awesome. That's awesome. So any projects, you have any projects that you're working on you want to share with?
Yeah, it's funny that you say that, because I've sort of indulged on a sort of a whole new sort of area of that we've never really ventured out in. And in the social media world, you know, everybody kind of has ideas about their website, their Twitter accounts, their podcasts, and all the above. And this show that you're doing, I think, is a great idea. Now, we also have our own show, my partner and I, and we call it the Ben and Gary Show. And it's called the Ben and Gary Show, We Know Dentistry. And we provide, you know, live podcasts as well as also videos on topics that we would think interesting. The last one that we did was just really, what's a porcelain veneer, and when do you actually need one of those? And so people ask questions with that, and we'd like to try and answer those questions for those patients there in a brief period of time, so that you know, it's on Facebook. It's actually on Facebook. It's at Smiles International DC, and it's called the Ben and Gary Show, We Know Dentistry. So we're getting in the same live world that you're in, Darwin. I think
that's what some people want, the information, and they want it how they want it. They want it, you know, 3 o'clock in the morning, or at lunchtime, or on the bus, or traveling in the car, or whatever it is. So being able to give that information to them is great. So Dr. Watkins, how can people contact you if they have further questions about some of the procedures that you do, how you run your office, or just looking for a mentor in that area of dentistry?
Well, honestly, I think probably the easiest thing to do is to communicate with me through my email address, and that's simply ben.watkins@smilesinternational.com.
ben.watkins@smiles.international.com.
You got it.
Hey, man, thank you so much for your time. I'm glad we were able to get together and learn a little bit more about your area of expertise.
Thanks, Darwin, man. I really appreciate being a guest on your show. I was really looking forward to it, and man, I love you, brother. And thanks for having me.
Hey, man, love you too. And if you guys love what you hear here with Dr. Watkins, or this series of careers in dentistry, you know, please shoot me a comment, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com, and maybe you can get your topic and we can get you on the show soon. Hey, Dr. Watkins, again, man, thank you so much, my brother. Love you much, and we'll be talking to you soon.
All right, man. Thanks a lot, man. Thanks. Anytime you want me on the show, I'm there.
All right. Thanks, man.
All right. Be good.